Hi, I'm Dr. Jeff Fialkov, and here are some reasons why patients choose to have rhinoplasty. If you're thinking whether or not to have rhinoplasty performed, it's important to consider the specific reasons that you're having it done. Many patients find that they toss around the idea but never actually make the decision. The best means of deciding whether or not rhinoplasty is the right operation for you is to consider the risks versus the benefits in your consultation with a qualified plastic surgeon. Here are some of the reasons why you might consider having rhinoplasty. 1. You've broken or traumatized your nose. When an accident does occur and your nose is injured, it may not heal correctly, and you may be left with a crooked or misshapen nose. Rhinoplasty surgery can help fix most problems that arise from a broken or injured nose. Straightening the nose, improving breathing, and removing a bump that arose as a result of the injury are outcomes that are very achievable with rhinoplasty. As a result, patients seeking rhinoplasty for problems that resulted from injuring their nose generally have a high rate of satisfaction. Number 2, you don't like the shape of your nose or the size. The most common reason for rhinoplasty is simply not being happy with the shape, size, length, or lack of symmetry of your nose. Often patients feel their nose does not suit their face because of the size or the shape. One of the primary goals of rhinoplasty in this regard is to reshape the nose or resize it to make it more harmonious with the rest of your face. For instance, someone with a narrow face may have a large, wide nose that would look better suited if it were made smaller and narrower with more tip refinement or definition. A more harmonious, better defined nose can result in less self-consciousness and more self-confidence. A qualified and experienced rhinoplasty surgeon will always aim for that harmonious natural appearance, while at least maintaining, if not improving, the patient's nasal breathing. Number 3, medical reasons. If you have difficulty breathing through your nose, you may be referred for a rhinoplasty procedure. This type of rhinoplasty may be beneficial for those who suffer from constant sinus infections, snoring, and breathing issues brought on by nasal airflow obstruction. An example of one of the causes of this type of obstruction being a deviated septum. The procedure can correct the problem, and patients may no longer experience breathing issues. It's important to note that the nose continues to grow and adjust in shape until a patient reaches the age of 18 or older. Therefore, rhinoplasty is generally not performed on patients younger than 18 years of age. If you are contemplating rhinoplasty surgery, it's important to sit down and think about what you want to get out of the procedure. Do you want a smaller nose? Do you think your nose is crooked and needs to be straightened? Your reason for wanting a rhinoplasty may be different than someone else's, but just as important. If you're ready to discuss rhinoplasty and how it can benefit you, call an experienced plastic surgeon. Thanks for watching.